Welcome back to Midday Kentucky, everyone. Well, there are many options when it comes to facial rejuvenation, with everything from surgical to non-surgical options. And joining me today to make sense of these options is Dr. Henry Wells and Susan Wells from Wells Plastic Surgery and Skincare. Welcome to the show. We've never had you both on before.
It's
together.
Good to be here.
Thank you for coming in.
You.
Okay, Dr. Wells, let's talk a little bit about where do people start when they decide to have something done with their skincare?
Well, as you said, there are a lot of options available to people, and I think it's important that you start with a comprehensive program that offers both surgical and non-surgical services so that they can put together a plan that's appropriate for you.
And Susan, your integrated practice and also your practice model, how does that work for your clients?
Well, you really do get the very best outcome because we like to say that he works with quantity of skin and redrapes it, and then we work on the quality of it after he's finished, and actually sometimes before.
I actually like that one, redraping. That's a good terminology. Dr. Wells, we're about to look at one of your patients before and after. Let's talk about her surgical options that she had to begin with.
Well, for this particular patient, we did two main procedures, upper and lower lid blepharoplasty for her eyes, and then a lower face and neck lift for the neck and face, lower face.
Okay, now, Susan, we all know that prevention is key, but also when you are considering to have plastic surgery, it's important to discuss the skincare routine.
Yes.
What type of skin treatments was this lady having?
Well, we started before her surgery even with some growth factor product and had her to do that to optimize her skin so she'd heal better. We also do a few treatments to help with lymphatic massage. And then afterwards we meet with her and come up with a plan because Kay has had a very adventurous life and we needed to work on the texture of her skin in addition to the quantity. Okay,
well, let's just talk a little bit about having the small talks that you have coming up in your practice as well. Now, there are 3 sessions that you're having, a minimum of 5 people. Why do people need to come along, and what is the benefit of these small talks?
Well, I think that what they'll find is that if there's options, everything from facials to faceless, and depending on their resources, which is time and money, they can begin to see what they can achieve and have a one-on-one conversation with either myself, Dr. Wells, the esthetician.
So is it a group environment?
It's a small group with a presentation, and then they'll have time to speak with each of us afterwards.
And I was about to say, one of the best things about doing that, Dr. Wells, is I might hear a question that I mightn't have thought of for myself to ask when you're sitting around a table, because you're all there for the same reason.
Yeah, I think it's a great way to get an introduction to the things that we offer. And people do have questions, and it stimulates conversation, and they do learn quite a bit in that environment.
All right, well, let's bring up all the information about this fantastic event that they're having. There it is, Facial Rejuvenation Small Talks. There are actually Monday, February 19th, that's next Monday, everyone. President's Day, 9:30 a.m. to 11:30, and 9:30, 11:30, and 1:30. 5 people per session. We're going to bring up all the contact information on how you can get hold and book the event as well. We appreciate both of you coming in here. We'll be right back after this short break, everyone.